Even when people leave their residence to perform these essential activities, they must practice social distancing. They must remain 6 feet away from each other at all times.
People and businesses found conducting non-essential business after Tuesday could face penalties or fines. During today's conference, health officials were able to provide insight on where our region stands with the virus. KCTV5's Greg Payne was there and talked with top health officials one-on-one, getting the answers on some of the commonly asked questions viewers have about testing in our area.
The coronavirus has taken the world, the country, and the region by storm. So where does Kansas City and the metro stand in regards to medical supplies?
There is a nationwide shortage of supplies, and many hospitals are looking at getting additional PPE supplies, making sure they have ventilators and, of course, hospital beds as we expect a surge of an influx of patients.
With that shortage, including face masks, many are asking if they can help by making masks and donating them to local hospitals. For right now, the answer is no.
We're hoping that the presidential order and that he will be gearing up, just like the war times issue of other kinds of military equipment in wartime.
But the equipment shortage isn't the only problem.
The biggest problem we have right now is that we're at capacity. So we don't have the capacity at this point to do as many tests as we would like to do. We want to do more.
An issue Dr. Joseph Lemaster says they are looking into, including possibly using old facilities for lab testings.
As you've probably heard, there are people who are waiting for their results, right? So the real bottleneck is the capacity of the labs to be able to run the tests.
So who is getting tested right now? At this time, Lemaster says with limited resources, their focus is mainly on testing first responders and those with critical medical conditions.
If you have a first responder who gets sick on the job and you need to take that person off the job, then you need to know whether that person was positive or not. It impacts the other people that are working around them as well.
But as soon as more resources come, the testing will spread.
Once have expanded testing capacity, obviously the ideal, WHO is calling for us all as much as possible to test everybody that's symptomatic. That's where we want to go.
Reporting in Kansas City, I'm Greg Payne for KCTV5 News.